Chloe, if you'll, okay, I see Chloe and Natalie. We'll start in a few seconds. We'll let you know when we're going live. I'll be streaming your presentation if you'll just say next for the next slide, okay? Three, two, one.
Good morning and welcome to the 2021 Coming Together for the Cure virtual education series. My name is Tasha Whitaker and I'm a community development specialist with Parkland. Today, we will kick off the topic of community and financial resources that are available to you within the Parkland healthcare system. Our first speaker to kick off today's topic is Natalie Boyle, CEO and founder of Mommies in Need. She's going to speak on the topic, caring for kids so families can access healthcare. If you have any questions, please feel free to drop those in the chat. We want this to be engaging, so leave us your questions and we will try our best to get to those at the end of all of the presentations during our Q&A session. First, we want to start by highlighting one of our community partners, Annie's Place. Please enjoy the video.
Okay. All right. Well, thank you, everyone. I'm so excited to be able to present this to you today. So my name is Natalie Boyle, and I'm the CEO and founder of Mommies in Need. And Mommies in Need is a nonprofit organization whose mission is caring for kids so families can access healthcare. Can we go to the next slide, please? Perfect. These are just some pictures of our building, Annie's Place, which you saw a little bit more of in the video. But it is a brand new child care center that's located on the Parkland Hospital campus that provides free drop-in care for patients or siblings who need to be getting medical care, and then we can take care of the kids so that the families can get that health care they need. If we could go to the next slide. So again, our mission is caring for kids so families can access healthcare. Just to know a little bit about us, so I'm a cancer survivor myself, and I had 18-month-old twins when I got diagnosed. So I went through a couple of really terrible years while trying to be a mom to twin toddlers, and just recognized there aren't a lot of resources for parents who get sick and may not be able to take care of their own children because they're disabled by an illness. So Mommies in Need was born. We provide a couple of different kinds of care through some different programs, which I'll go through in just a minute. But it is, came really from a grassroots perspective of kind of recognizing that care wasn't available when I needed it. And then a friend of mine, Annie, who we named Annie's Place for, she had colon cancer and 2 small children and didn't have family in town or some of the resources I did. So essentially it was really started when I sent the nanny who had helped me take care of my kids to my friend and started fundraising to pay for it. And so very quickly, we were able to recognize that a lot of people needed this kind of care, and that's how we started the organization. So just within our mission, we are there to serve kids whose parents need medical care. And so a lot of our families are cancer families, but we also have all other kinds of medical issues that we can take care of. So we are there for mental health, for addiction recovery, for preventative care, and for palliative care. Those are all things that are kind of within our mission to serve. And we also have expanded to taking care of kids whose siblings need medical care. So for example, at Parkland, that would be the NICU and the burn unit. But if parents need to spend time with their children who they are in the hospital or attending medical appointments, we can also watch the siblings at that time. And then the last is for hospital staff who need emergency backup childcare to work. And that is something we started doing because of the pandemic, but then recognized that actually is something that's always needed, because if we can't get the people who are taking care of the patients to their jobs, then we can't get good medical care for their families. So it's all kind of within what Mommies in Need believes our mission is to do. So can we go to the next slide, please? Okay, so talking a little bit more about Annie's Place. So Annie's Place is the child care center on the Parkland Hospital campus. We opened in November of 2020, which was quite a time to be opening a child care center, but we really recognized that people needed this help, and we started then. It's on the campus of the Parkland Hospital, but it's in its own freestanding building. So it's on Butler Street. If you're familiar with that, kind of Butler and Harry Hines is where we're located. Everything that we do is free of cost to our families, and so it is free child care for ages 0 to 6. And then we are able to accommodate older children, particularly during the summer or on holiday breaks when we know. So kids up to really about 9, 10, even 11 years old really can use our center, and then during those breaks when they're out of school. We have a specially trained multilingual staff, so almost all of our staff is bilingual, English and Spanish. We also have a full-time social worker and a play therapist there. And we are an alternate care, so we are not a daycare that you would typically enroll in, but we can care for each child up to 15 days a month. And so some of our families that are in cancer treatment may need that many appointments. For example, if you're in radiation, you have to come every single day for a period of time. We can watch the kids. Basically, the way that it works is you drive up, you drop off your children at our beautiful brand new daycare center, and go to your appointments, and then come back and get them at the end of the day. We have research-based curriculum that's offered in English and Spanish. We have 2 different programs. So the one in the video that we were talking about is the exempt program, and that is you have to be on the Parkland Hospital campus. But we also have a license program where if you're able to give us the child's vaccination records and their medical statement from a doctor, then we're able to actually enroll them in the license program, which means we're able to provide not only care while you're at your appointment, but also what we call respite care. So for example, if you get chemotherapy on Mondays and you know that typically your worst days of the week are Thursday and Friday, then we might be able to provide care for that appointment on Monday, but also for you to drop off on Thursday and Friday so that you can rest on the days that are the most difficult. We have multiple classrooms and a beautiful indoor play space, and everything's kind of separated out by age. The other nice thing is that we provide everything you could need. So our goal is that there's no barrier to care. All you have to do is bring your child, and we take care of everything else. We provide healthy snacks, hot lunch. We have diapers and wipes, formula. We even have extra changes of clothes for the kids. So all you have to do is bring your child, and we take absolute wonderful, loving care of them. We train all of our teachers in play therapy, and I'll talk in a second about our play therapy staff. So if we could go to the next slide. Oh, these are just a couple of our kiddos and some of the comments that we have from our families. We really do try to take not just basic care, but really excellent care of the kids that we serve. We also know that a lot of these kids are struggling. It might be their first time ever being dropped off at a daycare center. They have parents that are going through a health challenge. And so with that, we are just there to give loving, kind attention to the kiddos. My favorite that I'm going to call out is a little boy in the middle, Jeremiah. He comes to us pretty often. And the last time he came, he said, "I give this place 1,000,000 stars," which we thought was just so sweet. We wanted to put it on here. The other thing I want to call out is that we do care for, when we say 0 to 6, we care for newborns. We actually have taken care of preemie newborns. And so we keep our staffing ratios very, very low. We know that our kids are often, they may be dropped off. They've never been dropped off before. They've got all kinds of things going on. So we are able to take care of even, 3-4-day-old babies, preemies, that will do one-on-one with one of our staff members. Can I go to the next slide, please? So we do have a play therapist on staff. She has a PhD in counseling with a specialty in play therapy. And so she has extensive training in play therapy, grief support, anxiety, trauma, medical play. And what we've done is, as we built the center, we did everything kind of with trauma-informed care in mind, recognizing that the kids that we serve, their parents are going through a medical condition. And so with that, even in our play area, we made a little mini Parkland hospital, but that's a place for kids to enact safe medical play so that while they're at our center, they're able to associate going to the hospital, not as something traumatic with mom, but something that's actually fun. And one of the things we love, and we hear a lot from our families, is that, they used to have to bring the kids, and it was this whole difficult ordeal, and that now when they go, and they'll wake up in the morning and the kids say, they say, "We're going to the hospital today," the kids actually get excited because they're like, "We get to go to Annie's place, that's so fun." And so for us, the goal is really to change that paradigm of it being this stressful, difficult thing for the whole family, but taking care of the kids in such a way that they love it and they want to come back. And then that takes the stress off the parents so that while you're there, you can just focus on your own health, on your own treatment. We'll send you text message pictures of your kiddos playing. We like to make sure that you feel comfortable and you know that your kids are having a wonderful time and you can really focus on what you need to do to heal. Can we go to the next slide, please? So something to know about our play therapy program. So we have, the play therapy program is located at Annie's Place. That's where our play therapist is. However, we kind of provide services kind of across the board. So you don't have to be someone who's using Annie's Place to use the play therapy program. Again, 100% free of cost, everything that we do. So our sessions can either be at Annie's Place or they can be virtual, although with the youngest kids, it's really best to do it in person if possible. The age range for play therapy is really 3 to 12 years is where there's, it's the place that we is the target age. However, there are some exceptions with older kids, and our play therapist is able to do kind of talk therapy with kids that are a little bit older. So each family can sign up for 10 free individual play therapy sessions, and then more sessions available if necessary once they can. I'm so sorry, my dog just started barking and I'm not sure how to stop that. So I apologize if you're hearing that in the background. Okay. Sorry. We also have sibling and small group play therapy sessions to address any concerns that might be related to siblings. And then we have different types of care. So weekly play therapy sessions, that would be some of you enroll your child. They come every single week. They work one-on-one with our play therapist. She also does interventions at classrooms. So if we see a kid that's having some aggressive behavior or difficulty settling in, we do have somebody who's an expert who can take them into a classroom and into a play therapy room and help a child calm down or express their anger or whatever they might need to do. She also will do parent consultations. So something that we want to make sure you know about is if someone has just gotten a difficult diagnosis and maybe you're just not sure how to tell your 6-year-old what language is appropriate to use for that, you can call us and you can actually set up a one-on-one either call or in-person session with our play therapist, and she can work with you to talk about, what's age appropriate for your child. And then we give all of our staff members, every single person that works there, training in play therapy techniques so that we all know kind of how to use these techniques to help our kids. And then just one quick client story. With just 7 weeks, we saw a child whose mom was in cancer treatment and who was really having a hard time adjusting. He had a lot of aggressive behaviors, which is really common for kids when they don't know how to get out their feelings. And in just 7 weeks, we saw an 87% reduction in aggressive behaviors from the child. And the mom really reported her parental stress levels decreasing greatly. And we all know stress is not good for you when you're ill. And so our whole goal is we take that off of you, and then hopefully you're able to feel even better. Can we go to the next slide, please? This is just a little bit more about play therapy. It's an evidence-based approach. It's using the play for kids who are too young to really be able to express their emotions, to just give them a chance to express those feelings, develop problem-solving skills. And you can see there's a whole host of areas that play therapy has been researched to be beneficial. Can we go to the next slide, please? Okay, so as I mentioned, Mommies in Need runs several different programs. We have our child care centers, which is Annie's Place, that's located on the Parkland campus. We have the play therapy program. Then we do have an in-home program. So this is currently paused because of COVID-19, but we're going to begin accepting applications again pretty soon. And what this is, these are really for the parents that are completely disabled because of a health crisis. So a lot of times this will be someone that's had a surgery to where they really can't even get out of bed. We do a lot with high-risk pregnancies, people that are on bed rest. That would be where we actually send a nanny into your home to care for your children. And again, this is a program that will be probably opening up again in the next 2 to 3 months. I'll give you our website at the end and you can check it out. And there is a list. If you're interested in the in-home program, we have kind of a wait list situation so that you can go ahead and apply for it. And then once the program reopens, we'll get in contact. So we go to the next slide, please. The last of our programs is our virtual program. So this was launched in 2020 in response to COVID-19. And so what we can provide with this is virtual nannies. So it's a one-on-one call. And the goal here would just be maybe on non-treatment days, just an ability to kind of have your child be really entertained, have this educational entertainment fun, but you might be able to take a nap for the only time during that day. You have to be in the home, obviously, because it's virtual. This is also how we've been able to kind of expand nationally and provide care. We are also currently in the middle of building out a very robust online community. And so this is something we expect to launch in December. And what it is a confidential place where you can sign up and connect with other moms who are going through cancer treatment or any other health issues. And so it has private message boards. Think of it as a Facebook group, but something that's a lot more robust and really has that privacy there. And so if anybody is interested in that, again, please view our website. We are going to be launching that in December, and it's going to be, I think, a really great program for moms to be able to connect with each other. All right, can we go to the next slide, please? I just wanted to give a couple more quotes from our families. You know, for us, one of our company values is extraordinary. And we want to make sure that we're not just providing kind of basic care. We are going above and beyond. We are making these children feel so loved and welcomed. We do all kinds of fun enrichment activities. We have different guests come out to do music shows for the children, or we have actors that come out and do story time. We really just try to build as much fun and joy into the day for the kids as possible. And so you can see here just quotes from our families of saying that, you know, that the staff is wonderful, the facility is beautiful, that it's a good, caring team, and that's what we try to be. So can we go to the next slide, which I think is the last. This is my contact information if you'd like to take it down. Catherine Coelia is our Director of Programs. You can also get in contact with her. And our website is www.mommiesinneed.org. And that is where you can apply for services. So you can just click right there on Apply for Services, fill out the form, and we will get back to you and let you know how you can enroll in the program. And so I just wanted to open it up now for questions. Yeah.
Thank you so much, Natalie. That was an amazing presentation, full of resources that I know so many people will be able to benefit from. We're actually going to wait to the end and get all of the questions. And so thank you so much for that presentation, because I know many people will have some questions. Up next, we have Chloe Johnson, and she is with Outpatient Oncology, and she's going to provide us a presentation about community resources.
Hey, hello everyone. My name is Chloe. I am the social worker for the Outpatient Oncology Clinic here at the Moody Center. So I work on the 3rd floor, and currently I'm covering all of the oncology patients. So I have been here around about 5 months now, and I've learned a lot. So my presentation today will be over just a few community resources that are available to breast cancer patients. So if we go to the next slide. Okay, so the first resource that I use or recommend for families or a patient that has financial needs. So there is a grant through the Susan G. Komen organization. So how a patient would apply for this is they would talk to the social worker, the case manager, about, their financial needs. So it could be a patient is having, immediate needs like struggling paying a bill, whether it's like a clinic bill or a utility bill. It could be other reasons as well. Depending on their stage of cancer, they could possibly qualify for this program. Now, Susan G. Komen has been around for many years and has assisted with doing many community organization events. You probably have seen their pins or their merchandise in stores. So they're one of the biggest organizations that we suggest for patients, not only just for this patient financial assistance program, but also to get specific resources or just education. So I did want to read off the mission that is strictly from their website. The mission of the Susan G. Komen Breast Cancer Foundation is to eradicate breast cancer as a life-threatening disease by advancing research, education, screening, and treatment. The Komen Foundation has affiliates in more than 100 U.S. cities, 10,000s of volunteers, many touched by their own or loved ones' fight with breast cancer. Help raise breast cancer awareness, raise funds, and lead local efforts to improve services and programs in that area. If we can go to the next slide. I'm sorry, can we go to the next slide? Okay, sorry about that. Go back 1 second, I'm sorry. So on this, you will see that the komen.org website is there, as well as the phone number. So it does give you what the information is about the patient assistance program. So depending on the stage, if a patient has stage 4 cancer, they would possibly be eligible for a $500 grant. If they are stage 3 and less, then they could possibly be eligible for a $300 grant. It's all based on eligibility criteria. A patient with illegal status could possibly apply. They don't have to have a social security number to apply. So it's open to just anyone to be able to apply for this patient assistance program. They do have eligibility criteria, which is on the website. You do have to be within a certain income limit. So all that information is there, and you can be directed off of komen.org. There's also the number 1-877-GO-KOMEN for patients to call as well. So if we can go to the next slide. Okay, American Cancer Society is another big resource that I utilize. Not only do they have the most amazing website for cancer-specific topics, they also have like a resource bank where patients can call, or anyone can call, just to get resources in the community. So what does American Cancer Society do? American Cancer Society is well known for their research. They also do much more. American Cancer Society aims to attack cancer at every angle by promoting healthy lifestyles to help prevent cancer. American Cancer Society researches cancer and its causes to find more answers and better treatments. American Cancer Society provides everything from emotional support to latest cancer information for patients or for those who are being touched by cancer. They have a helpline that is open from 24 hours a day, 7 days a week. So I frequently use this just for specific research topics. It could be what are some resources for a patient that is interested in fertility preservation. So many women that are young, they're interested in finding banks or resources if they have low income, to organizations where they can go and preserve their ovaries or their eggs before chemo. So American Cancer Society can provide a list of organizations or resources for the patient or whoever is calling, whether it's a case manager, social worker, nurse that's calling, they'll be able to provide those resources for the patient as well. So if we can go to the next slide. So breast cancer groups is another big thing that they have offered. They're virtual. They have a website where the person can go in and enroll. I have included it on this slide. It's reach.cancer.org. So basically, if a patient is either like just now got this diagnosis, going through treatment, or a survivor, they could elect to either volunteer or join the support groups. And what the support groups are peer support. So you'll be speaking with a person that has been through this battle, and they will be able to share their experiences and bond with you or the patient on a level that, possibly other people cannot. So there's also an option for volunteers. So if a person that is a breast cancer survivor wanted to volunteer to be a peer support, they could also volunteer and apply on this website. The calls are virtual, like I was saying, so you'll have an app that you'll utilize. So the patient will schedule times where they can meet with their peer, and they will do virtual calls. If we can go to the next slide. Okay. So this is not just catered specifically for patients with breast cancer, but cancer in particular. So American Cancer Society has what's called the Hope Lodge, and it provides a free home-like environment for patients and their caregivers. So patients staying at the Hope Lodge must be in active cancer treatment and permanently reside about 40 miles away from their cancer treatment center. So the Dallas location that we have has opened back up September 13th. So, and it's with limited capacity, I believe about 14 people. There is a referral process, and it has to be completed by either the social worker or the case manager, and then it will be sent in to the representatives with Hope Lodge. Their information is online for the referral process and the application. However, you could call them directly just to get that information sent to you. So they are requiring for future residents to be vaccinated. So you will have to provide proof of vaccination for you and your family that will be living with you. So you have to reside 40 miles out of the Parkland Center. So for patients that have been traveling to Parkland for treatment, whether it's chemo or UT for radiation, then and they're living in about 2 hours away or in another county and they're about 40 miles out, we can apply for this while they're receiving their treatment. There's technically no end date of stay. So if a patient needed to stay here while they were doing 3 months of chemo, then they could possibly do that with the Hope Lodge. They are also working on trying to be able to provide transportation from the Hope Lodge to their treatment center. So I don't know if that has started yet, but they were working on getting transportation service for their facility. So each one offers a supportive environment for patients in cancer treatment and their caregivers. It's close to their local cancer treatment centers. They have their own private guest rooms and bathrooms, fully equipped community kitchens for food storage and preparation, gathering areas. They have great rooms and community dining rooms. They have free laundry rooms with supplies. They have outdoor areas for reflection and meditation, a library for resources, TVs, computer access, volunteers that will be able to assist them during their stay, and staff members as well. So the number, the location is all included on this slide. If we can go to the next one. Okay. Another big bank for resources that I use is Aunt Bertha. It is findhelp.org if you are searching it on the web. So Aunt Bertha has been around since 2010 and was founded in Austin, Texas. Aunt Bertha is a network that connects people seeking help or social care to providers that can serve them. Aunt Bertha has thousands of organizations, communities listed on the website that can assist with things from housing resources, clothing, food, financial assistance, COVID-19 related resources, transit, legal, and many more. So over 7 million people have used this app. So it's either an application that you can download on your phone. It's free to anybody that wants to use it, or you can type it in your web browser, findhelp.org. So a lot of the resources that I sometimes provide to patients can come from findhelp.org. So once you get onto the website, it'll ask for the zip code. And then so you'll put in the client's zip code or the patient that you're working with, and then it'll be directed to a drop-down menu where you can select what they're needing assistance with. If they were wanting assistance with food pantries, housing, some other social groups, connections, or any other resource that they may be coming to you asking for, you will be able to find some resources in Aunt Bertha. And it makes it easy for you to export the resources, so you can either print them off for them or you can send them via email. You can also export them, download them, and send them to yourself if you wanted to do that as well. So can we go to the next one? And one more thing, I forgot to say that Aunt Bertha is now in Epic. So a lot of people who you may service, if you wanted to start an encounter for them, you would be able to click on the Aunt Bertha tab and find resources. Now, when it comes to mastectomy products and prostheses, so oftentimes I will have patients who are needing these products. There is not a lot of resources for wigs, unfortunately, for people that do not have income. So there are a few organizations that would be either to, provide it at a lower cost or donate it. So for the wigs, the Bridge Breast Network, they do work off of referrals. They are able to provide donations for wigs if they have what's in stock for the patient. So if they don't have the wig the patient may want, then they would have to seek another option. But they do, as well as other stuff too as well. So eBeauty is another one that offers free to low cost donations. They either have like gently used wigs or wigs that have been donated to them. So it's based on if the patient will be able to qualify. And a lot of these organizations go off of financial assessment, so you'd have to financially qualify for these. The next one is the Vermin Foundation. They also do custom wigs at no cost for women or children fighting cancer and dealing with, they do provide free. I have not worked with this organization yet, but the patient, I have heard about it. The patient must pay for shipping though. So what the patient can do is go online and search for the product and apply. And whatever the shipping cost is, they will be responsible for that. Pink Hearts Funds is another one that is able to provide these wigs as well as Tender Love Care. Now, Tender Love and Care, they provide wigs at a cost, however. So they may not be as expensive as other places, but it is expected for patients to have to pay. For prostheses and mastectomy bras, again, if you are uninsured or if the patient is uninsured, there are some options for them, but not many, unfortunately. But the Bridge Breast Network is able to provide, the bra and the prostheses if they have it in stock to the patient at a donation. They do, again, work off of a referral, so they would have to have a referral and an order sent into them. The Pink Hearts Association as well, they will be able to donate. It's based on what their assessment is as well. Women's Health Boutique, they are at a cost. So if a patient is not able to, if the patient has insurance, their products could be possibly covered full price. If not, they may have a copay. But for the out-of-pocket patients, they do try to provide discounts to them. So it may be like a 10% or it may be a little bit more. So it's just case by case. If we could go to the next slide. I really don't have to do an in-depth presentation on Annie's Place because it was just presented, but that is something that I did include on this slide just because we do have a lot of moms or, patients that have children that are seeking childcare while they are in treatment. And those are just my references, but that is it for my presentation. I apologize. I'm not able to hear if you are speaking. Sorry.
Can you hear me now? Okay, I'll repeat that. Thank you so much for that presentation. It was an amazing presentation full of great resources. Again, if you do have questions, please put those in the chat and we will get to those questions during our Q&A session. Up next, we're going to highlight another community partner, the Bridge Breast Network, and we're going to show a quick video. After that, our next speaker will be Hope McGee, and she's going to speak on financial assistance. Enjoy the video.
Hello, I will be going over the patient funding overview. With the patient funding overview, the comprehensive health plans, Parkland accepts various comprehensive health plans for services provided, including Medicare, Medicaid, TRICARE, CHIP, ACA, and most major medical insurance plans. We have financial counselors located throughout the business office, the Moody Clinic, various Parkland community clinics, also known as the COPC sites. The Texas Department of Health and Human Services offers various state and federal programs for women and men specific to their certain visit types and services. Financial counselors are trained to screen unfunded patients for the following grant programs, as well as the Medicaid program. Those services are included, but not limited to, BCCS, which is also known as breast and cervical cancer screening, family planning, obstetrics, also primary care for PCP visits, epilepsy, HIV services, which is also known as Ryan White program. Our Parkland Financial Assistance Program is a charity program that provides health care for the eligible Dallas County residents. It is not considered a health insurance. Parkland Financial Assistance is available for medical services received here at Parkland. Prior to enrollment for the PFA program, Parkland Financial Counselors must screen patients for all other health care programs. Applicants who are potentially eligible for the Affordable Care Act, which is also known as the ACA plan, will be required to apply during open enrollment. Note to all, PFA is the payer of last resort. On all other funding options must be exhausted first. The eligibility requirements are the following factors are considered in establishing PFA eligibility. You must be a Dallas County resident, have household composition for your immediate family, your income, resources for Medicare recipients only, your immigration status. All others must pursue third-party health care coverage if potentially eligible. For a Dallas County residency, a person applying for PFA must live in Dallas County and declare their intent to remain here in Dallas County. A person is not required to have a permanent dwelling or residence, for example, meaning homelessness. Applicants living in a homeless shelter, domestic violence shelter, or a host home in Dallas County may be considered for Dallas County residents. A person's immigration status is considered, but is not a final determining factor. Income is defined as any type of recurring payment that is of a gain, benefit to a household. The income of all PFA household members is considered, excluding the minors. The submissions of the application forms can be completed. A completed PFA application form can be submitted via MyChart online, U.S. Postal Mail, also in person at any of the CLPC sites. For the PFA cost sharing portion of it, applicants with a gross income of 0 to 100% of the FPIL will not be assessed a copay at the time of services. Applicants who are assessed a copay must agree to make a good faith payment at the time of services. The patient's ability or inability paid does not affect the eligibility for PFA assistance in emergent situations. We also have the self-pay charity discount program. And with this program, the self-pay charity discount program consists of 8 plan levels. The patient level is based on their FPIL and county of residency. SPCD is for patients who are ineligible for PFA who would otherwise be self-pay. The SPCD enrollment period is for 12 months, and patients will have to submit an application with the required proofs for the SPCD levels. Here you see a copy of what a PFA application looks like. And when you submit that application, once again, you can submit it through a postal mail, any of our COPC sites, or online through our MyChart. Here is the required documentation list, and it consists of 4 different areas of this. You would provide us with proof of identity, proof of income, proof of residency, and the household composition. And what that is stating is any minor that is under the age of 18, for example, birth certificates for anyone under the age of 18. The next slide here it shows our asset resource questionnaire form. And this is where the resources of our household members are considered. Resources are either countable or exempt. You can find all our PFA forms on our Parkland website, which is www.parklandhealthhospital.com. And if you have any questions in regards to that, you can contact in regards to your PFA application submission process, call the PFS call center at 214-590-8831. Thank you.
presentation, Hope. That was an amazing presentation with great resources. So now we're going to go into our Q&A session with questions. We had quite a few questions come through. So I want to go back to our first presenter, Natalie. One of the questions that came through was, are you planning to add additional locations for Annie's Place?
Yes, so Mommies in Need has always planned for this to be a pilot program that we did with Parkland that we hope to expand to other hospitals, potentially, community clinics. It's absolutely something that we hope to expand throughout Dallas and eventually beyond. So that is in the plan.
Awesome. Well, I'm sure people are happy to hear that because you guys provide some wonderful resources for the community. Our next question goes to Chloe. How does someone connect with a social worker at Moody?
So it depends on if you are in clinic or not. So if you are calling in, then you can contact me by just asking whoever you're on the phone with to be connected to the oncology social worker. There's only one now that's specifically to oncology. We have another one that does more of our transportation needs. And then we will be having a new social worker next week that will be more towards breast. So you can always call and ask to speak with the social worker. And if the patient is in clinic, then they can ask their provider if they would like to speak with the social worker, and then they'll just say why.
Thank you. Thank you for that. One of the questions for financial resources that came in, Hope, was how long will it take for me to find out if I'm eligible for Parkland's financial assistance program?
Good question. If all the required documents have been submitted, you can actually get that approved the same day. However, if there's some missing documentation where we have to request additional documentation, if it wasn't submitted on that particular day, it would take up to 7 business days.
Okay. Right. I'm going to go back to you, Natalie. Someone asked, do you have to be a patient at Parkland only to receive this service?
No. So a majority of the spots are reserved for Parkland patients, but if we have space available, we will absolutely take patients that are coming from other places. So that is an option. And then as well, I talked about a little bit about our respite care. That kind of falls under that respite care. So even if you are a Parkland patient or a different patient that needs additional help on days that you're not actually at the hospital, that's something we can potentially accommodate as well.
Great. Chloe, how does someone apply for Social Security disability?
So that is a common question that we get here at the clinic. Unfortunately, we're not able to directly apply with them, but we do refer them to the Social Security Administration. And if they are able to apply online, it'll be a lot quicker. So I encourage them, if they have family or maybe like a younger sibling that's technology savvy, if they could assist them with applying online. And they can do that through the Social Security Administration website, and it's www.ssa.gov/disability-SSI. And they can also do it by phone.
Thank you for those resources. Thank you very much. And we had one last question that came through. Is there a patient financial counselor at Moody to specifically help?
Yes. We actually have patient financial counselors located throughout Moody on each level, 2 on the outside areas of each level, and then we have a numerous amount of them located for where the breast center and the breast imaging location is as well. So we have plenty of staffers readily available to assist with funding.
Thank you for that. Well, that is all of the questions that have come in today. I do want to thank each and every last one of you, Natalie, Chloe, and Hope. Thank you for your amazing presentations and the resources that you provided the community. I know that they will be utilized and helpful for many people. I want to invite all of the guests back for the Spanish version today. It's going to start at 1 o'clock and it will go until 2:15. Our last day for the CTC will be tomorrow. So come join us tomorrow for the very last day of CTC, and we hope to see you again tomorrow. Have a great day, everyone.
Thank you.